Hello, I'm Dr. Roy Picard, and I created this video for the residents of Shelby Township, Michigan. And what I'm going to discuss are the different types of tests that are often overlooked when it comes to helping a child who has either been diagnosed with having, let's say, ADHD or even suspected of having ADHD, even though they may not have yet been appropriately diagnosed. Brain function is the most important thing that needs to be addressed with these kids. In some of my earlier videos, as well as the information on the Michigan ADHD website, I talk about the functional disconnection syndrome, which is common to all of these kids, and how important it is to get the brain balanced. And brain function is dependent on two things, both stimulation and body chemistry. The body chemistry has to allow for proper fuel to the brain in order to function at its optimum. So how do I determine which areas of the brain require additional stimulation? There are specific, non-invasive tests which are geared for specific age levels that tells me which areas of the brain require additional stimulation. Some of these tests will assess if there is a visual processing problem, an auditory processing problem, a motor skills delay, perhaps there's lack of coordination or a problem with timing or rhythm. There might be deficiencies with fine or gross motor skills, and there's much more to look at. As far as the body chemistry evaluation or the metabolic analysis, again, it's pretty much dependent upon ability, but we may need to evaluate such things as blood sugar, cortisol levels, the amount of good bacteria in the gut, or if there's any bad bacteria or fungus or parasites. We may want to look at thyroid function, assess how well oxygen is getting to the brain. We can look to see if there's a high count of bacteria or viruses. We can check iron levels, liver function, immune system function, kidney function, and much more. What I want you to understand is this. There's a great deal that can be done for these kids, but unless they are getting the right types of tests, unfortunately, your child will not have the opportunity to truly reach their optimal physical, mental, social, behavioral, or academic level of performance. Also keep in mind that these particular tests that I'm talking about, they need a functional assessment as opposed to just the, let's say, traditional medical analysis. So for more information, you can either go to michiganaddadhd.com, or if you're interested in setting up a free consultation, then call my office and speak to my staff at 586-726-9860. Again, I'm Dr. Roy Picard, and I wish nothing but the best for you and your child.